non-surgical options for hair restoration actually work? The answer is maybe. The fact of the matter is every scalp is different and everybody's timeline is different. So younger patients that maybe do not have a lot of actual hair loss and maybe have hair thinning and what we call volume loss, non-surgical treatment may be the best option. And that includes things such as topical or pill form of Rogaine, which is called minoxidil. We often prescribe Finasteride and typically do this with low-dose Finasteride to minimize the chance for sexual dysfunction, anxiety, and depression, which is oftentimes seen with people taking it on a daily basis. And some treatments, such as platelet-rich plasma injection, can be beneficial. With more advanced hair loss, especially if it's associated with a receding hairline or a significant loss of hair in the crown for men, hair transplantation is the best option. Many patients will go through spending a lot of money, sometimes thousands of dollars, doing medical management or doing painful injections such as multiple PRP injections with the hope of restoring hair loss. That simply is not going to happen. Hair restoration is the way to go.